Hello, this is the second part of the presentation low back pain. What to do for low back pain. In the first part of this presentation, we've learned about various conditions affecting the spine leading to low back pain, such as degenerating discs, bulging or prolapsed disc, pressing on a nerve root, um, formation of bone spurs leading to arthritis, and so on. Now coming to diagnosis part of low back pain, most important is certainly your symptoms, because based upon the intensity, the duration, the type of your symptoms, your physician can make the determination regarding the tests that may become necessary. Examination by a doctor certainly plays a big role. X-rays are done in many cases as the first step toward diagnosis. One word about CT and MRI testing. Unfortunately, these tests are being done indiscriminately even when they are not necessary. A lot of times, people with low back pain tend to have simple enough reason to explain the pain that they have, and these expensive tests will not be necessary. On the other hand, in certain situations, these tests do play a very important role, and your physician should make that judgment. EMG is another test that is done in some situations, and lab tests, blood work, and other tests as and when necessary will need to be done by your physician. Let's talk about management of low back pain. Now, let me first mention some very basic steps which are important for everyone suffering from low back pain. They are lifestyle changes. Absolutely, physical activity is essential. Get up, move, walk, stretch, do something, do some activity as opposed to sitting or leading a sedentary lifestyle. Every step that you take matters, so move more. By doing so, you're actually strengthening your back muscles and thereby reducing the pain intensity. And if you're a smoker, absolutely you have to quit smoking, because smoking has been shown to be a very important risk factor for developing back pain. If you are overweight, losing weight is going to go a long way in improving your symptoms, because weight certainly, especially if the weight is around your waist, that can put a lot of stress on your back and cause back pain. And make sure that you perform some stretching exercises on a daily basis. Practice yoga, which is a very good way to stretch your entire body, including your back, and relieve or try and reduce your stress level by practicing meditation, relaxation techniques, whatever suits you, because stress certainly can make the pain worse by causing muscle tightness, muscle spasm, and so on. And if possible, do not ride a two-wheeler or a three-wheeler on city roads. I know this is not a very easy suggestion or recommendation to follow, but whenever possible, try not to go on these vehicles, because they tend to put a lot more strain on your back, especially when you're going on roads that are not well laid out, especially if you're commuting long distance to work. This can put a lot of strain on your back. And make sure that you maintain proper posture all the time. And important suggestion that I'd like to give everyone is make sure that you maintain enough calcium and vitamin D intake. It has been shown in many reports or studies that Indians typically tend not to get enough calcium and vitamin D in their diet. As everyone knows, these elements or substances are extremely important for maintaining bone health. So drinking low fat milk or skimmed milk, making sure that you eat 1 to 2 cups of curd every day will go a long way in strengthening your bones. Now, from the basic steps to the next steps that you can take to help relieve your back pain. Physiotherapy is an important and effective remedy Periodically, depending upon the intensity of your pain, you may want to try it for 4 to 6 weeks. And once you've learned the proper exercises, you can certainly practice it at home, and you should on a regular basis. And gentle massage therapy also is helpful. Using ice packs or a heating pad to relieve tightness in the muscles is quite effective also, especially when the pain starts getting more intense. And make sure that you apply that ice pack or heating pad to the affected area for at least 15 to 20 minutes and do it about 2 to 3 times a day. Certainly you can try pain relief balms, sprays and lotions, understanding that they provide only very temporary relief. Now this is very important for you to note that bed rest is not really helpful in most cases. Now there is always an exception to this rule, but for most patients who have chronic low back pain, bed rest is not the right way to treat it. Activity as tolerated is absolutely essential and advisable. Let's understand the role of medicines in managing low back pain. I'd like for you to pay close attention to the next few slides. The information that I'm going to show and share with you might seem a bit overwhelming and confusing when you watch it for the first time, but if you take the patience and watch it a few times, you will start understanding what I am saying a whole lot better, and thereby take the right steps in managing your back pain more effectively. Alright, there are, broadly speaking, 3 different kinds of painkillers. The first one is paracetamol, commonly known as Crocin in India. Of course, it exists under many other brand names. We'll talk about that in a minute. The second category is called NSAIDs. Just remember this word for now. We'll discuss in more detail in the coming slides. And the third category of painkillers is morphine-based pain medicines, which are not used that often in the Indian setup. We do have a few medicines from this category, but for the majority of cases of back pain, the medicines that are prescribed belong to the second category on the screen, which is the NSAIDs. Muscle relaxants are the other category of medicines used for relieving back pain, and others, basically these include a combination of the first two categories, meaning painkillers in combination with muscle relaxants, commonly prescribed in India by many physicians. And there are medicines from other categories which are prescribed for long-term use. These do not fall under the category of painkillers. They belong to a totally different group of medicines, and I would say that their usage is also not that common in the Indian setup. Most commonly used painkillers in India for managing back pain are NSAIDs, and of course muscle relaxants are also prescribed quite often. Let's talk about that first painkiller called paracetamol. I would say by far that this is the best pain medicine that is available for us. Now keep in mind that paracetamol is not just a fever reducer. The reason I say this is because a lot of times people think of Crocin as just the kind of medicine you would give for bringing fever down, while it is in fact a very, very effective pain medicine. It is quite safe for long-term use, has very few side effects, does not cause drowsiness like some other medicines. And one important thing to remember is that when people are taking painkillers, most of the time they are also taking other medicines. Some of them are chronic medicines, such as those for high BP or high cholesterol or diabetes and so on. So you'd want to make sure that whatever medicine you're taking, in addition to your other medicines, does not interact with them adversely. And paracetamol is one such medicine that does not interact with most other medicines. These brands you will probably recognize: Crocin Pain Relief, Dolo 650, Calpol, and there are many other brands of paracetamol available in India. And an important consideration, especially if you're taking also other medicines, is that costs do add up pretty fast. This medicine is quite cheap and works well. Keep in mind that the total dose per day should not exceed 3000 milligrams, because overdose can cause liver problems. Now, also keep in mind that as long as you stick to the recommended dosage, there is not much of a chance that you will have any significant side effects from taking this medicine. It's always a good idea to discuss these issues with your physician before starting treatment, but the one take home point I would like to reiterate is that paracetamol is an extremely effective pain medicine, and for chronic pain this is one of the best options there is. And I'm not just talking about the Indian scenario, I would say this for the Western population also. Just so you know, the one very popular brand of paracetamol that is commonly used in the US is called Tylenol. Alright, let's talk about NSAIDs. This is the second category, if you remember, in the painkillers list I mentioned a couple of slides ago. What exactly are NSAIDs? I also mentioned then that these are the most commonly prescribed painkillers in India. The expansion form for this is non-steroidal anti-inflammatory drugs. As I mentioned, most commonly prescribed painkillers by doctors. They relieve pain as well as swelling. If there was to be any swelling in the muscles, in the tissues, these medicines help relieve that, in addition to relieving pain. Now there are hundreds of brands available in India, many different kinds. The one thing though to keep in mind is that both cheap and very expensive brands have almost the same effects and same side effects. Commonly used brands in India: Brufen, Mobicam, Aceclo, Indocid, Naprosyn, and so on. These are just a few names that I happen to mention here, but again I'd like to say that there are hundreds if not thousands of brands available. Now there are some issues with NSAIDs. They have many side effects. Now compare this to paracetamol. Overdose can lead to liver problems, I mentioned. Otherwise very well tolerated, quite safe to take on a long-term basis. Whereas with NSAIDs, the side effects are quite a few. If taken on a regular basis, they can cause acidity, heartburn, stomach pain, even peptic ulcer and stomach bleeding. They can contribute to high BP. So if you already have high BP and it is uncontrolled, taking these kinds of painkillers is probably not such a good idea for you. Heart disease and these medicines do not go well together. And these medicines are known to cause kidney and liver damage if taken on a long-term basis. They can also cause fluid buildup and swelling in the body. And if someone has asthma, these medicines are known to worsen asthma. So these are some of the main issues that you will need to remember if you're taking these medicines on a regular basis over a long period of time. So they have to be taken with great caution if you have heart disease or high BP, if you have or had a stomach ulcer. If you have kidney disease, they are best avoided, and certain other situations that your doctor will need to discuss with you before prescribing these medicines. Now, whenever you take these medicines, like I mentioned, they are the most commonly prescribed painkillers. So chances are that if your doctor has written a prescription for a painkiller for you, it will have an NSAID in it. So keep in mind that these are the main side effects and issues with these medicines, so you have to take them with great caution. A few words of caution regarding a medicine called Nimesulide. First of all, this medicine is sold under many brand names in India. Many of you may know that this medicine has been withdrawn from the market in many countries across the world, but unfortunately still available in India. It may cause liver damage, and that is the main reason why it has been withdrawn from the other countries. But unfortunately, in India, it's still being prescribed by some physicians. In addition to causing liver damage, it also can cause the other side effects that we've discussed previously. And it is no more effective than the other NSAIDs that are available in the market. So your physician really has no excuse for prescribing this medicine for you for relieving pain. Make sure that you ask your doctor if the painkiller you're taking has nimesulide. Better yet, check the prescription when you get it from the pharmacy. Talk to the chemist, check the label and see if it has nimesulide. If it does, tell your doctor that you're not willing to take it, so he or she can prescribe another medicine in its place. I also mentioned earlier that muscle relaxants are commonly given for relieving back pain. This is one of the other treatments that is commonly prescribed. But a word of caution regarding taking muscle relaxants on a regular basis. I would say that it is not advisable to do so. Drowsiness is a very common side effect with these medicines. Can slow down your reflexes, especially dangerous if you're driving or on the road, if you're an older individual, if you operate any kind of machinery, if you're a bus driver, and so on. And ask your doctor if the medicine being prescribed is a muscle relaxant or has a muscle relaxant in it. Sometimes there might be combination prescriptions with NSAID and a muscle relaxant combined. So you will need to know if that is the case, so you will clearly know what to expect from taking this medicine. So briefly, I'd like to say this. There are, as far as painkillers are concerned, two main categories that are commonly prescribed in India for managing back pain. One of them is paracetamol and the other is an NSAID. Most of the medicines being prescribed for relieving pain fall into this category of NSAIDs. They have many side effects, like I mentioned in one of the previous slides. You may want to review that one more time when you have a chance. So be cautious if you're on one of these medications. Make sure that you do not take this type of medication on a long-term basis. Switch to paracetamol after talking to your doctor and understand the side effects, and do not take nimesulide ever. When you're taking any kind of muscle relaxant, make sure that you're not taking it on a long-term basis. Lifestyle changes are as important as painkillers for managing back pain. Make sure that you make those changes. Stay active. Stretch your back regularly. Lose weight if you need to. And maintain a healthy lifestyle so you can keep this pain at a tolerable level and are not dependent on medications over a long period of time. Thanks for watching.